Emergency doctors and nurses are having to defend how busy their hospitals are, calling comments made by the Health Minister misleading.
Andrew Little said he hadn't seen any figures to support claims by top emergency doctor John Bonning that emergency departments were seeing record numbers of patients. Alexa Cook reports.
It's no secret our hospitals are under the pump and emergency departments are reporting record delays and patient numbers.
We are very clear about what is happening in the departments across the country. They are reporting unprecedented pressure and volumes within their departments.
But Health Minister Andrew Little told the Herald he hadn't seen any data to support that.
It is concerning that that point of view was taken.
The minister also accused the college's Dr John Bonning of making similar claims about record delays.
We've been showing people figures, and for Andrew Little to say there is no figures to back up what John Bonning was saying, I think it's sad.
Having this undermining of health professionals is just absolutely not necessary. It was really disappointing that the government fails to address the issue and acknowledge it.
An issue that nurses and doctors are on the front line of.
We are seeing nurses who are still at the end of a shift bursting into tears. This is something that I never thought we would see on such a regular basis.
Patients are being treated in hospital corridors and ambulance bays.
There is more chaos because effectively the departments are overcrowded, so we have patients everywhere and it's really difficult to do a good job in that situation.
So we are going to have some deaths on our hands.
A stark reality if there aren't enough doctors and nurses.
OK, Alexa, what does the Health Minister have to say about all of this?
Well, Andrew Little wasn't available for an interview, but he said in a statement the Herald had asked him to respond to a claim that there was a record number of people turning up at emergency departments, to which he responded saying that he hadn't seen any figures showing that. He said a major factor here is the state of our primary health care, with more than 300,000 Kiwis not enrolled at a GP, and that puts pressure on emergency departments because they turn up there instead. Now, just this week, the new health reform bill, it's passed its third reading in Parliament. So he is hoping that scrapping that DHB structure might just save our struggling healthcare system.
Yes, indeed. Alexa, thanks very much.
Well, let's get the latest on COVID cases now. And 5,200 new cases were reported today, a drop of 1,000 from last Saturday. 8 people with COVID have died, the youngest in their 60s, bringing our total of publicly reported deaths to 1,311. And 332 people are battling the virus in hospital. 4 are in ICU or a high dependency unit.